Okay, thanks everybody for showing up today. My name is Anna-Kathryn Burch. That's ANNA-KATHRYN. Last name is Burch, B-U-R-C-H. I am a pediatric infectious disease physician here at Prisma Health Children's Hospital in the Midlands. And we're going to be talking today about RSV, but really we're going to just be talking about respiratory viruses in general and what's going on in the community and in the hospital here at Prisma Health. So basically, we are in October. Traditionally, at least for the last 2 years, we have known that COVID has been the main circulating respiratory virus that has been going around. But that has become more of a cold-like virus. And so we are seeing a lot of viruses that we traditionally have not seen in the past 2 years, but we normally see kind of raise their ugly head again. And what viruses are those? So right now we're seeing RSV, and that's respiratory syncytial virus. That is a traditional virus that infants and young toddlers get that can affect the respiratory system and make children have a harder time breathing. It also can cause some fever. Technically, we call it a bronchiolitis. RSV is the #1 virus that causes bronchiolitis, but there's other viruses that can do that as well. Most of the time, children do very well with RSV, but they can have to go into the hospital if they're having a very hard time to breathe. And normally, that would just require usually a day to a couple of days of hospital stay where they might require some oxygen and maybe some fluid because they got a little dehydrated. Interestingly, from what I have been seeing, at least in the Midlands area, not only are we seeing kids get hospitalized for RSV, but we're also seeing secondary bacterial pneumonias on top of the RSV. And that is something that's a little bit different. I think that one of the reasons that is the case is because for 2 years now, we've all worn masks. And so typically, kids will be in contact with RSV and it won't be so much of an issue. They make antibodies towards that virus, right, that circulate around in their body. So when they see RSV, usually it's not that bad of an infection. But since RSV hasn't been circulating around the last 2 years because of COVID and because we've been all wearing masks, those antibody levels that are normally high in children have really kind of dropped down. And so we're seeing more severe disease with RSV. That shouldn't make you worried as far as, oh my goodness, my child's going to get RSV and they're going to get hospitalized. Most children, even if they get hospitalized with RSV, do well and not have any problems. They might have to get some antibiotics for that secondary bacterial pneumonia, but they've been doing well. The other thing that is starting to rotate in the seasonal respiratory virus carousel is influenza. And so we as a group, infectious disease group, are very, very concerned this year about influenza. Just like RSV, influenza is the same. We haven't really had a big influenza season over the last 2 years. Again, that's mainly because COVID has been the majority of the virus that's been circulating around. And so now that influenza is kind of also coming back as far as numbers are concerned, we're also concerned that those lack of antibodies is going to make this year's influenza season much worse. We have already seen that happen in Australia. They had a pretty bad influenza season, and because they're in the Southern Hemisphere, obviously they go through influenza season first. So we're anticipating that is what's going to happen to the United States this year. And we're already seeing it with cases cases that have been hospitalized as well. And so that's something just to be on the lookout. What are some things that we can do to help protect our children from these circulating respiratory viruses? Well, number one is to make sure that you are doing good hand hygiene that we've been preaching for the last 2.5 years, making sure now that we're not having to wear masks. If you are ill, then you do need to try to wear a mask, okay? This is something that will help protect others. If you are sick or your child is sick, wearing a mask will help protect others. But also, you need to use very good cough etiquette, right? And so making sure that if you don't have a mask on, that you're coughing or sneezing in your sleeve, and that you're using very good hygiene afterwards, hand hygiene afterwards. And then lastly, what we can be doing is making sure that we're getting our yearly flu vaccine. Right now is the time to get your flu vaccine. I promise you that in the next several weeks, we are going to see a major uptick in influenza cases. And I'm really worried that a lot of those cases might end up in the hospital just again, because we're expecting a pretty bad flu season. So that's the best way that you can protect yourself. If you get your flu shot, it is not 100% in protecting you from getting the flu. But what it does for you is it protects you from getting any kind of what we call morbidity or mortality from the flu. And so that means that it can protect you from getting hospitalized from the flu, from getting secondary bacteria and pneumonia from the flu, and also potentially from dying from the flu. So it's actually very, very important that everyone 6 months of age and older go now and get your flu shot. It takes several weeks for your body to make those protective antibodies once you get the shot. So right now is the time to go and do it. And I will take questions.
Dr. Burch, I know that the kids are back in school and this is really their first year back full time. So should we also be reminding families that if their child is sick to please remember to let them stay home as, prescribed by the schools and by the doctors?
Absolutely. I mean, that's one of the biggest things that you need to do is if your child is ill, especially if there's fever, don't send your kid to school sick. Please don't do it. It just makes everything worse as far as being able to spread to other classmates in the school. And this is for any respiratory virus or any sickness in general. You should really keep your child home if they are ill.
Of course, next week is Halloween and everybody wants to be out and about. So what would you say to families as we're preparing for Halloween and being out and about? Would you say that they should wear a mask? Or what would you say about that?
Well, Halloween is an outside, right, activity. So I would just be cautious, making sure that you're not allowing your child to go trick-or-treating if they are ill. And then, it's your choice whether or not you want your child to wear a mask. But definitely, try to stay away from large groups of people if possible. Trying to kind of keep your family together when you go trick-or-treating, and then that way you might not be exposed as much to respiratory viruses that are going around right now. It's not harmful if you want to put your child and yourself in a mask, for sure.
Right. So question, this is a two-part question. What kind of RSV case numbers are we seeing in South Carolina, and does the flu vaccine work on RSV?
Okay, so I'll take the second question first. Does the flu vaccine work on RSV? Unfortunately, it does not. Right now, we don't have a vaccine for RSV. We are working on one, and hopefully we'll have one come out soon, but there is nothing as far as prophylaxis goes for RSV. The best thing that you could do there is hand hygiene and making sure that, you are keeping your children away from other sick children, et cetera, hopefully not to get it. And then as far as numbers are concerned, I know Tammy has a graph that she was going to give y'all access to. These are numbers that we're currently seeing in the Prisma health system. Right now, as far as hospitalizations are concerned, we're seeing more RSV being hospitalized than we are influenza. But I would say I'm expecting in the next several weeks to see that reversed, where there will be more influenza hospitalizations versus RSV.
Okay, the question is, can at-home breathing treatments work for children?
So at-home breathing treatments can help children if they already have a history of reactive airway disease or asthma. It won't necessarily help a child who doesn't have the diagnosis of a reactive airway disease or asthma. So you shouldn't be giving like siblings treatments if they don't have that diagnosis.
Right. Question is, have we seen any cases, if any of the cases we're seeing in RSV are school-age children?
Good question. Most of them are younger children, actually, at least that I'm seeing in the hospital. Can RSV occur in older age children? Absolutely, it can. It can happen in adults as well. But typically in those ages, it's more of just a really bad cold than it is bronchiolitis. Bronchiolitis, where it actually affects the way that an infant or a child breathes and requires oxygen consumption, is typically in that younger infant to toddler age child.
Okay, the question is, have we seen any deaths at our hospital from RSV?
Not that I'm aware of. So I don't know information about the upstate.
Right. And if we also can check with DHEC if they also have that. Other question is, what ages are most likely to contract serious cases of RSV?
Typically, RSV is a more serious disease in the infant and toddler age. So 2 and below is typically where you're seeing more severe cases. This is a little bit different year again this year. Remember, I told you that we're seeing a lot of what we call secondary bacteria pneumonias associated with RSV. And those have been in toddler age to younger age children, less than 5 or so. Doesn't mean that they are so severely ill that, you know, something bad is going to happen with them, but it is requiring hospitalization.
Are children with pre-existing conditions more likely to have a serious reaction to RSV?
Absolutely. So kids who have underlying respiratory diseases, kids who are medically fragile. And so typically those are children who might have CP, or cerebral palsy, or might have a neurologic brain disorder. Those children are at much greater risk for worse outcomes with RSV.
If this question is related to the majority of the cases in South Carolina, I'm not sure we have the answer to it. Where are the majority of cases in South Carolina? That's more, I think, a DHEC question.
Yeah, that is more of a DHEC question, but I just know with friends and what's going on in other children's hospitals, we're full to the max across the state. So it is definitely a statewide issue, I think, with RSV, and the flu is going to be the same way.
Dr. Burch, could you explain to a parent whose child may have RSV and is at home being taken care of, when would it become a time when they would need to bring their child in for additional care?
Yeah, that's a great question. You know, it's kind of scary sometimes when you have a kid at home who has RSV and you're looking at them and wondering, gosh, when do I need to take them to the emergency room? When are they going to be at risk of having some of these worse complications with RSV? It really has to do with how your child is breathing. So if you are seeing any kind of extra breathing, that is something that you worry about. And what do I mean about extra breathing. I mean, where you can actually see the child breathing so hard, they're sucking in, and you're seeing this area of the neck kind of going in and out. If you're looking at the ribs and you're seeing the skin going in and out between the ribs, if their breath is, the respiratory rate is so much that we're at, 50, 60, 70 times a minute, those are times where you probably need to seek care, at least from a primary care physician, or go to the emergency room. They might need some oxygen at that point.
I know, Dr. Burch, we have at Prisma Health Children's Hospital, we have the pediatric emergency department, and they're there all the time to try to help with that.
Oh, yes, absolutely. We definitely have our emergency room. It's pediatric based. It's a great place to bring your child. So definitely that's a great place to go. But you could also reach out to your primary care physician as well if you're just concerned about, should I take my child to the emergency room or not? Your primary care physician should have on-call physicians that you can talk to as well.
This question is related to whether have you ever heard or seen any deaths in the past from RSV?
I mean, of course, there has been deaths in the past with RSV. That is something that, any infectious diseases can cause deaths, right? What that number is, I'm not sure. That's definitely a DHEC question as well.
Yeah. What is the timeline of the infection? How long does it take to show symptoms?
So most of the time it starts out with a runny nose, a cough, maybe a little bit of fever, but days into the illness is where you can see the bronchiolitis part, which is where you have really an increased rate of breathing and potentially having what we call hypoxia, which is having a hard time keeping the oxygen up in your blood. So RSV can last just like any cold. It can be 7 to 10 days. So it is something that definitely, you can find worsening of the illness in those later days, somewhere around 4 days of illness. The other thing with RSV that's very interesting is it can what we call wax and wane, meaning that you can look great one day and then the next hour or two you can look really bad and have a harder time breathing, and then you might get a little bit better the next day, and then you might get worse the next day. So we call that waxing and waning, and that's something that we see as well.
Right. Speaking of respiratory viruses, what are we seeing right now in the way of flu and COVID to go with this? Yeah.
So if you're looking right now at the numbers, and I think on that graph, Tammy, it'll say that we're seeing testing wise more positive tests. I'm pretty sure it was influenza number 1, RSV number 2, and then COVID number 3, as far as that what we call 4-plex, where we test for all 4 of those viruses together. And so that's why I was saying, right now in the hospital, we're seeing a lot of RSV, but we've been seeing that for the last at least 3 weeks. And so that's why I predict in the next couple of weeks, we are going to be seeing more hospitalized patients with influenza over RSV.
All right. So, is there an earlier than normal time in the year? Is this an earlier than normal time in the year to see respiratory illnesses?
So not in general for respiratory illnesses. For RSV, yes. Your traditional time to see RSV is typically in the winter and early spring. This is the right time for influenza, however. Usually October, November, December, January is kind of your flu time season.
Doctor, I think that's all the questions. Wait, one more. Hold on, I said that and then two came up. Okay, all right. Let's see. Are pediatricians regularly testing for RSV? How are people tested for it?
Yeah, it is something that you could easily do. There's rapid testing that can be done. We definitely test for it in the emergency room. That doesn't mean, though, you need to go to the emergency room to have your child tested. That should be something that should be done at the primary care physician level. Emergency rooms are for emergencies only. And so really you should be looking out for your primary care physician to do that type testing. But it's an easy test to do. It's kind of just like the flu. You stick a swab swab in the nose and you run a test to see if it's RSV positive or not.
Okay. Should parents shift their focus from COVID?
So great question. COVID seems to be, in my opinion, on the way out, at least as it stands today. Obviously, there's always new serotypes that go around, and we might see an uptick number of COVID in the future. But currently, as it states right now, RSV and influenza are the two big respiratory viruses that you need to be concerned about. And especially, in my opinion, influenza. This is the time to get yourself, your family, your children protected against influenza and really go out there and get that flu shot. Anybody 6 months of age or older should be getting a flu shot.
I think this is the final question. Is influenza impacting the same age group as RSV?
Yes, it will impact the same age group, but it also is going to impact the older age group as well. And so this is, that's one thing about influenza. Traditionally, you think of the very young and the very old have worse outcomes or can have worse outcomes with influenza. That's that morbidity and mortality number can increase. And typically it's the 20s, 30s, 40-year-olds that do fairly well. Again, that's with traditional seasonal influenza, but we really haven't had a major flu season in the past 2 years. So I think right now we're just concerned across the board, right? That the flu is going to be bad for all age groups potentially this year. And
Okay,
that's
so
why we're really, really harping on everybody to get vaccinated.
Good job. So I think that's all the questions, Dr. Burch. I think as we see the national news, we're seeing a lot about RSV and I think you've talked about the flu, and then of course we still have COVID out there. So what would be your final thoughts to families out there that are concerned about these respiratory illnesses for their family?
Hand hygiene, hand hygiene, hand hygiene. Keep your child at home if they are sick, and please go out and get your flu shot. Those are the 3 big things that you can do. And if you are ill, wear a mask outside.
Good deal. Those will be our final thoughts. Thank you for joining us, everybody.